This video features a presentation read in part by the speaker. Phoebe Nelms speaks on a Zoom call.
And it is 12 o'clock on the dot. Welcome everyone. We're so delighted you could join us today for Network for Community Engaged Primary Care Research Learning Series entitled Using Secondary Data Sources to Tell Community Stories. Just a few housekeeping things before we get started. Please keep your mics muted during the presentation, and should you have questions, please put them in the chat. We'd be delighted to answer them at the end of today's presentation. And lastly, we have an evaluation link that will be dropped in the chat at the end of the presentation. Please be sure to click the link and let us know how we did today. We really appreciate your feedback because it really helps us improve our learning series experience. And thanks again for your understanding and consideration as we went over those housekeeping rules. So without further delay, we'd like to introduce today's learning series subject matter expert and presenter, Dr. Peter Baltes. Dr. Baltes is a social epidemiologist and professor in the Department of Community Health and Preventive Medicine. He is a senior researcher with the National Center for Primary Care here at Morehouse School of Medicine. His research and collaborations fit under the broad umbrella of health disparities, whether the disparities are socioeconomic, ethnic, or geographic. He has served as a project PI for an American Heart Association study that examined cardiovascular disease resilience among African Americans and African American communities. He has also conducted research examining county-level health disparities and county-level determinants of health, focusing on identifying counties that may be resilient in having little or no disparities. Since the start of the pandemic, he has engaged in research on race and geographic disparities in COVID-19 outcomes. So Dr. Baltes, you have our attention.
Good afternoon, everybody. I will try to get started right away here. So let me pull up my slides. Oh, I didn't share the screen first, I think, is my problem. Just hold on 1 second. Oh, my screen is disabled from sharing.
Hold on 1 second. Try it now, Dr. Baltes.
We'll try again. Okay, now it appears to be working.
Sorry about that.
No, that's all right. Okay. All right. And all right. So everyone see the PowerPoint now?
Yes.
Okay. All right. So today I'm going to be talking about accessing secondary data sources to tell community stories. So I'll be using the slides, but I will also be going to websites that are linked to in the slides. So the hope is that if you all already have the slides in PDF form or whatever form it's in, you'll be able to also click and follow along. You can put in your own addresses that you want to look up, but definitely do it after the presentation too, because this might seem like a fire hose of information, trying to get a lot in a short time. But the idea is just to give you an idea of what is out there, and you all can get in there and play with it yourselves. So what is secondary data, right? Well, first off, right, what is primary data, right? Primary data is data that you collect yourself, or it's collected to answer a research question. You have the research question, you go do a study or some other data collection to answer that question. Secondary data is data that's already been collected, either from a past study or part of a past data collection effort, the census data or NHANES data. And the great thing about secondary data is that it's often available online for free. And since we're telling community stories, it's good to get to what is the definition of a community. We kind of throw that word around. It can mean a lot of things, right? And these are some Webster definitions right here. So it could be the people with common interests living in a particular area, or broadly the area itself, a group of people with common characteristics or interests living together in a larger society. It could also be a body of persons or nations having a common history or common social, economic, and political interests. So why will we cite data to tell community stories, right? So for one, you're oftentimes it's in one way or other trying to advocate for a community, right? Whether it's to present something to a political body or to actually write a grant to receive money to either do research or intervention, right? And so if you're able to get a hold of data and present it, it allows you to describe the population and or the community that you are working with. You can describe the demographics or other characteristics of that community. It also will allow you to describe the health need of the population or community you're working with, right? If you want to do a study on heart disease or address heart disease disparities, it's nice to know, well, how many people actually have this condition in the community that I'm interested in. And overall, if you're able to make your case, your story, using data, it'll greatly strengthen your application and thereby strengthen your chances of being funded. So let's just start with population data. Okay, and so when people think of population data, they think right away about census data. And so it's not necessarily easy sometimes, though, to find the actual data you need. Unless you are a researcher and you're used to pulling down data sets and doing that. But there's this one link here.
The URL is data.census.gov/table. He navigates to the website, which features a table, a search bar, and a wide variety of filters.
We'll go to a part of the census website where you're able to get some ready-made tables. All right, so this will be not necessarily just national data. This actually goes down. If you look on the left, right, there's nation, state, country, county subdivision, and zip codes and stuff. It also goes all the way down to the census tract, which I'll talk about later. But a lot of those tables aren't ready-made and produced up here. But the cool thing about this site is if you look up top, right, you can do a search. And so if I did a search, say, for poverty in, I think I could do Atlanta, actually. See if it'll come up. All right, so I can go all the way down to the city of Atlanta. I could do this for the state of Georgia. I could do it for the whole country, right? But I'll click on the city of Atlanta and see what comes up here. And sometimes it takes a second for these tables to load. Okay, so if you take a look here, all right, this table, the very first row, right, this will be, poverty status for the entire city population, right? So that 470,993, that is the total population of Atlanta. If you look over, though, under below poverty level, right, we can get the estimate that 81,337 people living in Atlanta are living at or below the poverty level. And if you scroll over to the right, it'll give you the percentage that are living below the poverty line. The other neat thing about these tables is they have them broken down by age groups, by sex, by racial ethnic groups. So if you needed an estimate for the percent living in poverty, city of Atlanta, for a particular group, it's right here for you. And you can even go down further here. Like I'm going to put in the zip code, and you'll see this will go right down to the zip code level. Right, so let's take a look there. Right, and so this was the zip code that I actually live in, and so you'll see here that right, even for the zip code, it's completely broken down by the different groups. So I'm able to get the number in poverty and the percent in poverty at the zip code level for each of these groups. Okay. So I'm going to present some Georgia-specific websites. I know a lot of you are in different states. So I'd encourage you to look at your Department of Health website and see what data resources they have. But I wouldn't necessarily stop there. If you don't see anything similar to what we have in Georgia, we have this great site called Oasis. I would get into contact with whoever is referenced on the data page for the Department of Public Health. And they usually like to help people and tell help you to locate where specific resources to your state, and sometimes even to other jurisdictions within a state.
He navigates to the Georgia Oasis website, which features a series of filter menus.
So, but I wanted to point out Georgia Oasis for the people in Georgia, but also to see what a query system looks like for data. And you can see here that what's really neat here is that I can actually request very specific data. All right. So if I wanted to know, how many 20, let's say like 20 and 29-year-olds. So if I just hold shift here, right, I can do that. For 2022, lived in Baldwin County, Georgia, who were Black or African American, and maybe I was only interested in females. And then I just click here and get data, and it will actually tell me how many people fit that description within that county in Georgia. Okay, and so that could be very helpful if you're writing a grant for a particular county, to be able to say this is what the population is in that place of the people I want to study. So you can see how this can be very powerful. Okay, so if we wanted to get some health data, all right, well, at the national level, because a lot of times we do want to make a statement about what's going on in this particular group I'm interested in the entire nation, so that I can then make comparisons to maybe other levels of geography too. Or sometimes that's all it's available for, honestly. Well, on this website, this is, when you see this NCHS, that's National Center for Health Statistics. And this is a great source of a lot of different data. Okay, if I go to the data finder here, right, these are really are pre-made tables. But if you go under all subjects here, right, you can see many different types of conditions, and also sometimes these are medical care, screening data, sort of thing, right? And so if I was interested in, let's say, cigarette smoking, right, and it'll let me put in subgroups, but you'll see that won't necessarily do much for me in changing what shows up here. Let's just say I was interested in smoking in Asians. Well, I'll just click there. It did reduce the number of things here, but when you click on these PDFs for the tables, right, and you can also get this in an Excel spreadsheet, right, you'll see I don't get data just for Asians. So it's not as specific as that query system we saw on the Oasis site. But if you look down through this table, you will in fact see right there for Asian only, we have the smoking rate for each of these years. And these tables actually also break it down by age groups too. When there's sufficient data, and poverty level and several other things. So again, nice place to get some quick data for groups at the national level. Now, I also want to talk about the BRFS which is Behavioral Risk Factor Surveillance System. Okay. BRFSS is a state level survey, but the data is aggregated and presented by CDC on a website. And the nice thing here is that you can click on any state. So I click on Georgia. And so sometimes it takes a second for things to load. And if I scroll down here, we'll see, right? It gives me the overall prevalence of whatever I asked for, right? So right now it's looking at alcohol consumption. But you can come in here and see there are a lot of different, there's a lot of different information here from the BRFS survey, okay? And then you can also look at topics, right? So within any of those class of information, there are several topics, right? So let's just look at overall alcohol consumption here, but you can also see binge drinking, chronic drinking, heavy drinking. And it'll give you a graph overall for the state. If you scroll over these bars, it'll actually give you the percentage of those who are, in this case, who've had at least one drink of alcohol in the last 30 days. Other cool thing here is that you can break these down. So let's look at this by education. All right. And I'm not sure if you're aware of this, because this is the pattern you see in most states in the country as a whole. The percent of people who drink goes up as a graded association with education, right? So here's your college graduates right here at 62.4%. And compared to those with less than high school, where it's only 27.9%. And so, yep, you can see this in graphical form. You can also do a screenshot of this and copy this graph out to put in any document that you are creating. Just make sure you source it to the website. It does say down at the bottom, right? As long as you copy and paste that part too, that is from the BRFSS survey, right? So, and if you wanted this in tabular form, you just click up here and you get a nice table of the percents and the numbers that were in the survey. Those aren't the numbers of people in the state, right? They're numbers who are in the survey, just to make that distinction. But the percents are weighted up to the state population to actually reflect what's going on in the state. So everything we've looked at has been at a higher geographic level to this point, right? But we're often, right, interested in neighborhood level data.
Yeah,
I think someone's mic is on. The government doesn't necessarily collect data on what we think of neighborhoods, right? And how we all have names for the neighborhoods in our particular city and sort of thing. What the government does through the Census Bureau is create a unit called a census tract. Now, these census tracts are meant to represent neighborhoods. And so every 10 years when they go to do the census, they reassess the boundaries for these census tracts. And based on similar demographics, but they also actually ask people, what do you consider your neighborhood? All right. And so they weigh all that information to create census tract boundaries. So they're meant to at least roughly reflect neighborhoods. And lots of health research, this is what we use, this level of geography called a census tract. And so they're generally have a population between 1,200 and 8,000 people, right? And as I mentioned, they're used as proxies of neighborhoods. And right, we also, we often see data nested, from the US as a whole, down to state, down to county and zip code. This is an alternative way of nesting the data. So it goes from, US to state to county to census tract to even smaller units, so census block group, and all the way down to census block level, you can often get data for. But it's the census tract is the one level that is usually used as to represent neighborhoods. Now, you may think that's all well and good, but I'm sure you're saying to yourself, how, I don't know what census tract I live in. I don't know what census tract neighborhood I'm trying to study. How do I figure that out, right? So first off, census tracts are labeled with a GeoID, geographic identification number, right? And this is a very long number. You can see it right here, right? It starts the 1 through here. But each part of that number represents a different level of geography. Okay, so the first 2 numbers represent the state, right? So in this case, 13 means Georgia. The next 3 numbers represent the county within the state. So this is County 89, which is DeKalb County. And the rest of the numbers represent the census tract. But the last 2 numbers are actually after a decimal point, right? So you see this 0, 2, 3, 6, 0, 1. That's essentially census tract 236.01 within DeKalb County, within the state of Georgia. Okay. Now there are some websites you can use to look up census tract by address. The first one is through the U.S. Census. Not surprising, U.S. Census would have a site. The second one here, this one that's put together by the Federal Financial Institutions Examination Council. I actually like this site better, and you'll see why in a second. Let's go to it. Okay. It's taking a second to load. So the nice thing here is I can put an address right here. All right, so I'm going to put in an address. Dancingplex Road in Decatur, Georgia. And the nice thing about this, right, is it'll immediately map the address. Okay, and so you can see right here, this red dot is the address I put in. And the blue lines are the boundaries of the census tract. Okay, you can also see, if you look closely here, or I zoom in, right, there's the census tract number right there, the 036.01. If you look over to the left to the table, right, you can see it there too. You have the state code, the county code, the tract code right there, and what metropolitan statistical area it is in, and what state it's in, and what county it's in. All right. So, so some nice things about this map, right? Obviously, you can zoom in, zoom out, right, to it. I'm just scrolling with the mouse, with the roller on the mouse. It also shows streets, right, which is very nice because you can see how the census tract borders often follow along streets, right? So if I'm thinking about this in the real world, I can go, oh, okay. So if I cross over McAfee Road here, I'm actually now in a different census tract. And so, this is great, I think, right? And so if you're doing work in a particular neighborhood or set of neighborhoods, you can come in here and, like I said, not just see the number of the tract you're in, but you can look at the numbers for all the tracts that are surrounding the tract you're interested in. And you can also see here that sometimes census tracts don't really contain people. So this green area with the lake in between, this is a golf course right here, okay? But it's still a census tract too. Now, the other great thing about this site is if you look over on the left where it says census demographic data, I can click here and it will give me information. Now, it's easy to make a mistake here when you quickly look at this. The first line of income here, that's for the metropolitan statistical area, okay? But if you go down, it will give you some more information about income and the minority population and some residential information about housing. But you can also click on these boxes, right? So get some more income information. So you see that, right? Median income was 84,791. That was, well, that's statewide. That's statewide, I think, or is it? And MSA, MD, statewide median family income. Let's see, that's for the non-MSA. So it's actually down near the bottom, all right, is where you see the tract. So there's the tract median income in 2020 was 73,000, and it had increased to 88,000 by 2023, at least estimated to. You can get population information here, right? So this will give you how many people in each racial ethnic group live within the census tract. And you can also get some housing information here, right? It's about things like owner-occupied units, even the median age and years of houses, stuff. So pretty cool. This is like a one-stop place to get quite a bit of information. And also, if you wanted to too, you could do a screen capture here, right? And copy off part of these maps to then, again, insert into any document you want to do. Okay. Oh, and so what about getting health information, for these census tracts, right? Well, again, for those of us who live in Georgia, the OASIS system has some great mapping tools on it. So let's just go there. And you can see on this site, you're able to get, mortality information, hospital discharge information, emergency room visits, and a lot of other stuff. I would just, those who are interested in Georgia's data, I encourage you to get on this site and just explore around. If you're in other states, again, go to your DPH website and see what they have. And again, inquire about what they have. Let's look at emergency room data.
He clicks on emergency room data under the mortality/morbidity section of the OASIS website.
And you see right here, I can get tables, but I can also get maps here.
The next web page shows a series of selection menus for different variables, including geographic and demographic information.
So if I come in here, all right, and you can see I can map counties. So I can make a map of Georgia and put rates on that map, display the rates of whatever condition I want for the entire state by county, right? But what's also cool here is I can go down the census tract level here, right? And so let's go pick DeKalb County, since that's where we were looking before. Okay. And we're going to look at 5-year aggregated data for 2018 to 2022. Let's say I was interested in, we'll call it premature cardiovascular disease. So starting at age 18, and I wanted to go up to 64. Okay, I can do that here, right? And I come into the causes, right? And let's see if I can find it on here. Major cardiovascular disease, okay? And we're just going to use all the subcategories in there. Let's say I was interested in Black men. I could come here, click Black. You can also break this down by payer, by Hispanic, non-Hispanic. So I said I wanted males. I can come here and hit males, right? And I just click Get Map. Okay, and you see we've got a map of DeKalb County here, and these are the census tracts within DeKalb County. And so you can see there's quite a bit of variation in where these emergency visits are coming from for cardiovascular disease. And I can scroll into this, to zoom in, and so here's the thing, right? Like, how do I know, where the census tracts I'm interested in are? Okay, well, there's a couple of different ways. On that last slide, I didn't go to the page, but you can actually download a map of the county. All right, and that can be very helpful to help give you the lay of the land. It'll give you a map of the county where all the census tracts are labeled, and you can take a look at that, find where it is, so that when you look at a map like this, you kind of already know where to look. But there's some other things we can do here to try to find it. All right. For me, for that track we looked at already, that track 236.01, I can find it very easily on this map, because if I look right here, I see this little rectangle down here. All right. And that's the golf course, right? There aren't many census tracts, right, that are almost rectangular, right? So that's how I know where that is. But if I wasn't sure, right, I can actually come over here and put on census tract labels. And lo and behold, there it is. That is the track that I was looking at. Okay, so then if I wanted to zoom back out, here's the thing though, if you zoom back out too much with those labels, this gets to be a mess, right? So you probably don't want to figure with them on, but it's fine if you zoom in, right? You can leave those labels on, and no one's gonna have a problem with that. But you can also see there's some other stuff we can put on this map, right? If I was interested in knowing where, I'm going to take off the census tract labels for a moment. If I was interested in where are hospitals, right? Well, we see there's no hospitals in this area, but if I zoom back out, right, I start to see, oh, where are the hospitals in DeKalb County? And here they are. And they also will map them in the surrounding counties too. You can put hospital labels. You can put labels. This might also help you find the census tract. You put labels for the cities and towns in the county on here. You can put the interstates. Sometimes that's helpful to help locate, you know, if you know where the highways are, to help locate the census tract relative to the highways. They also let you do major roads, Georgia House and Senate district boundaries. That might be helpful for political advocacy. And you can also put on other layers on the map, like socioeconomic vulnerability and demographic clusters. So definitely very cool site for the state of Georgia. So if you're interested though in places, I mean, you're interested in Georgia, the site will work too, but if you're interested in census tracts in anywhere in the country, CDC has this great website called CDC Places. And this uses that BRFSS data. Okay. Just one word of caution here in the interpretation. What we have here is not the actual numbers or percentages for what's going on in those census tracts, okay? What we have are projections for those census tracts based on state level data, county level data, and because we don't collect enough data from every single census tract in the country to make any stable estimates that way, right? So what do I mean by a projection, right? So if we know, you know, from the BRFSS survey, you know, the rate of anything from that survey, right? By race, ethnicity, by age, by gender, and maybe even socioeconomic characteristics. If we know what that looks like, right, for the state and or the county, right, well, we can look at the demographics in those census tracts and say, well, if the census tract is, you know, essentially the same in its relationships to the outcome that we're interested in at the state, well, with this demographics, we would expect this rate of the outcome in this census tract. So yeah, I mean, obviously we'd really like to know what the actual real numbers are, but this is very helpful anyway, because in the absence of anything else, something is better than nothing, right? And so you can still use this information to say, well, in this neighborhood, we believe, you know, that there's probably this percent of people who are obese or have been to the doctor in the last year, and stuff. So let's just go to the site so you can get a look at it.
He navigates to the cdc.gov/places website and clicks on the interactive map image.
Oh, by the way, on that OASIS site, it allows you to save those maps. So you can save them as a file, the PNG file that you can then, or you can do the screenshot thing with it too. So I just wanted to point that out. Now, all right, so you can see we have data here for the entire country, right? And right now it's clicked on arthritis. Okay, so this is what arthritis looks like, or what we think it looks like by neighborhood in the entire United States. Well, actually, what you're first seeing here are counties. Okay, so these are counties. Let's scroll down into Atlanta, and darker usually means a higher prevalence of whatever the outcome is, and lighter, lower, right? So I can scroll in and you see I'm looking at Atlanta. As I scroll in, it goes down to the census tract level. All right. And it's really convenient that I picked, a census tract next to a golf course, because there it is, there's the golf course. So pretty easy for me to find that. But if I keep scrolling in, no, I'm trying to scroll down further. Let's see if I can get there. All right, so there's the golf course, and I believe this right here is the census tract. So let me see if I should be able to click on this and get information. And there it is, look, it says tract, and this was the number, right? You can see that 2306, right? It gives me what the projected estimate is for having arthritis among adults living in the census tract. And it's, in this case, it's 24.6%. And all right, so that's great. Like I can get information. If I click these arrows right here, this will give me the population of the census tract. This looks like it wasn't updated to 2020 data yet. There was the population in 2010. But you can see there's estimates for all of these conditions here. So any of these things you're interested in, you can get it down to the census tract level. So I know that's particularly cool for things like obesity, because we often don't have obesity data down to these smallest levels. And then these are all health outcomes. So you see here, there's these different headings, right? If I go to prevention, right, you can get information on things like whether they have health insurance, had an annual checkup, dental vision, dental visit, blood pressure medication, cholesterol screening, mammography, right? And you can also get to health risk behaviors, right? That's like, they have a few of them here, right? So they've been drinking, smoking, physical inactivity, sleep, disability information, like different types of disability. Again, that's not something that's always collected to a fine degree in surveys. So it's nice to have some projections down to the neighborhood level and some general health status information. And again, with this too, you can, you can zoom in, take a screenshot of a particular area you want, and, then bring that into your document. So, the final thing I just wanted to say here is that, all the stuff I've showed you, right, is pretty easy for people without a lot of training to access and get usable data. But if you do have data analysis and management skills, you can go to these websites and get the data set and analyze it yourself. Because a lot of those tables I was showing you were actually derived from these surveys, the National Health Index Survey, NHANES, National Health Nutrition Examination Survey, and the BRFSS, which I've talked about a lot, and that'll actually, you can get some city level information from that. And I can have time, so I can just quickly show you what I mean by the power of this. If you have the data skills to do it. Let me see if I can get out of this and pull up. All right, so right here is, this is the NHANES data set. All right, and let's say I was interested in something that I know I'm not going to find on the internet, especially, right? Is like, well, what percent of people have elevated C-reactive protein, right? C-reactive protein is a measure of inflammation, okay? Just to say, there's lots and lots and lots of information in the NHANES data sets, right? And because they do a physical examination, they do a blood draw sort of thing. Now, it's not broken down geographically, but you can get information by the different groups, racial, ethnic groups, the age, gender, and the subgroups, that intersect in all those areas. Okay. So I've set this up. I've done a lot of the data management already. We're not going to go through that. But you'll just see if I run just a frequency here, and on this high CRP variable, and I just make sure that I'm getting the population size here. I also have a percent. I can continue and okay. And I'm using SPSS here. I don't know if I said that, but other statistical programs can do this too. What you see in this estimate column, this is how many people in the US population, this is the estimate for having high C-reactive protein, right? And so the one thing it doesn't do is put commas in. So I have to always track down, but this is 69 million people, over 69 million people with high C-reactive protein. Like I said, you would not have found that on the internet, right? And so, like I said, if you have data skills, or you have someone working for you with data skills, I'd encourage you, if there's a question you need to answer, to get into the NHANES data and start to use it. And then I also have just the estimates of the percents, right? And this lets you see what's going on behind the scenes. The unweighted count is actually how many people are in the survey, and this is how it's statistically weighted up to the US population. Okay, well, actually, I think I am done. And so if you all have any questions, just feel free to chime in or put them in the comments.
Okay, I'm looking at the chat. I don't at the moment. Let's see, here's a question. How common is it that states have sophisticated mapping tools like Georgia?
It's a very good question. And I'm sure there's more and more going on online. Now, I have not done a survey of this. That'd probably be a good paper, honestly, if anyone wants to work on it, right? What is available in every state, that would, and that might actually, cause some states to go, hey, maybe we should do that. So anyway, I would think some of the better funded health departments out there are going to have it, is the thing, right? So I would look in the bigger states to have them, but sometimes you're surprised. Sometimes it's surprising. Like sometimes even some of these smaller states, they just hire the right people, I guess, and do some really nice stuff with data. But like I said, when I was looking the last time I gave a talk similar to this, like I don't think Alabama had it. I could be wrong, which was disappointing because I was teaching this stuff in Alabama, and I wanted to show them that and everything. But yeah, so yeah, you're just gonna have to get out there and do it. But if anyone knows, put it in the comments right now if you know a particular state. And actually, for any of these questions, because I don't know everything about mapping anything, there's so many different things out there. I just wanted to give you a quick overview, mostly about population and some, basic health data.
Well, we have so many positive comments, Dr. Balchus, and on your presentation. One comment is that if someone could love a database, I love the places database. That's a comment from an attendee.
Yeah, it's great. It's, it really is great. It's the thing, like, because where else are you going to get at least an estimate of that type of thing at a neighborhood level? Yeah.
Another comment, Dr. Balchus, you mentioned that many of these data sources are pretty user-friendly, but some require more data analysis skills. Do local health agencies generally have the skills needed to access and analyze data from multiple data sources?
Do the local agencies? You probably would know better than I, so here's the thing, like, like I said, like with the NHANES stuff, you either need to be taught how to do that or really get into the documentation, right? And so yes, you can learn how to do that. Now, the pulling together from multiple sources, that shouldn't be too difficult, honestly. If I'm thinking you're thinking like at area level, right? And so if you've got a list of census tracts or you've got a list of counties, say, and so you have maybe some population level data. We do this all the time, population level data and some health level data, right? You can just merge that data together by the county. And so most people with some data analysis skills should be able to do things like that. That shouldn't be all too difficult. And that, because I didn't even get into that whole aspect. Like there is other area level information out there. Like the USDA has food desert information. That's one source we've used and merge that to health outcome data stuff. So yeah, I do think that stuff shouldn't be too difficult, honestly. So yeah, hopefully if they've got a data analyst, they have the ability to do that. I see someone's asking about teaching biostats. Right now I'm teaching within Morehouse School of Medicine, and yes, I teach statistical computer methods course, yes, and we cover how to do this stuff in SPSS and in SAS actually, and I also teach other students secondary data research at Morehouse School of Medicine.
One other question. How do data users in community settings deal with lags in census data collection, results being made available, for example, when pulling together annual reporting?
Lags, yeah, lags are not fun. And it just is what it is. Sometimes it takes a long time. Like even with this NHANES data, right, which is a national survey, right now, it only goes up to the data that's out there only goes up to March 2020. Now, whereas the NHIS, the National Health Innovator Survey, that's another survey that's under National Center for Health Statistics, they have data all the way up to 2022. So lags, yeah, lags are a real thing. And you can only use what you can use. You can only use what's out there. Yeah, this, and things I think did get slowed down during the pandemic for some of this stuff, right? Because everything was focused on COVID. So all the resources in the health departments went towards just COVID data. Yeah, so the lags are probably even worse at this point for a lot of stuff.
Which statistical analysis tool do you prefer?
The answer is it depends. Um, so I like to teach SPSS first to people who don't have any data experience because it's less abstract. It's more like a concrete feel to it, and I think that's really helpful rather than putting people right into coding. You know, for a lot of for big data management, I actually prefer SAS even to R because it's a lot of the way it's set up. It allows you to merge more data sets together, like with one line of code, kind of thing. But I've recently, within the last couple of years, gotten into R a little bit because that's the nice thing about that is it's always being updated, right, by people out there, right? And so if there's some new type of analysis you want to do, someone has written some code to be able to do that. So it just really, like I said, just really depends what I'm trying to do. If I already got like a data set that's ready to go and I just need to produce something quickly, SPSS is great for that. But it just really depends what I'm trying to do.
Here's another one, Dr. Baltus. Are you familiar with databases that can be harmonized so that they can analyze health variables at a local level with social determinants of health for community and county level analysis?
Yeah, so are you familiar with databases that can be harmonized? I'm reading it too, so we can analyze health variables at the local level with social determinants of health for community and county. Yes, I mean, it just depends what you're trying to do. So because we do this all the time, right? And so, oftentimes we'll get health data from the state. Sometimes you have to purchase that, unfortunately. I'm trying to think where else. If we, with COVID, there was just a lot of freely available data out there at, say, the county level, and then we'll just, merge that together with census information sometimes, right? And we also trying to think, and then that was, like I said, the USDA data on food deserts. We used that to merge together at the census tract level, even for that. A lot of people have done county level, so we did that at census tract level. That we had some data from a study at the census tract level here at Morehouse School of Medicine for the Atlanta metro area. And we're actually working to make that so if people write a research proposal, they can maybe get access to that too. So it's out there. The data is out there. It's definitely out there. A lot of it. So, like a lot of other things, like people ask for, is actually sometimes tougher to get, like crime rate data, say, right? People want to know what crime rates are in neighborhoods, and sometimes you might have to go to the county or city police department to be able to get that data. They may publish some of it. So yeah, you just a lot of times have to just track down stuff. If it's not freely available on the internet, sometimes you can get a hold of it by requesting it, is the thing.
Well, we thank you so very much for the depth of information you shared and the resources. And the questions keep rolling in if you would address some of those.
Right. So yeah, for mental health or substance use prevalence. Okay. So again, down to the small level, it could be a little bit difficult. You saw that in CDC places. They had the depression in there. I mean, that's a simple measure of depression. I think they just ask if you felt depressed within a certain time period, maybe in the last 2 weeks or something. But they do have projections in there down to that census tract level. Substance use, I don't know of much that I'm trying to remember if BRFSS has anything. I don't think it does. Now, there's national surveys that have some information on that. What is that one? National survey It's one that's in teenagers. There's a couple different ones that are in teenagers. There's the YBRSS, I think, that I think does ask some information, but it's not going to be, you're not going to have the geographic aspect to that. So that is one of the unfortunate things in with some of those questions, is that you might be able to get some national estimates, and and oftentimes break it down right by race, ethnicity, age, gender. But yeah, still you do run into difficulties getting these things projected down to smaller levels. Yeah, like someone's asking about the specific, trying to get specific information, right? They're asking about if it's cancer screening data and you want it for people 45 to 70, but there's only 45. You want it for 45 to 60, but there's only 45 to 70. Yeah, that's one of the limitations of secondary data, right? I often like I give a bigger lecture on secondary data. It's a little funny because like what are the strengths of secondary data, right? The data's already been collected, right? I don't have to write a grant and wait months to be able to collect data. It's already there. But what's the pitfall of secondary data, right? It's already collected, right? And so it is what it is, right? So, but in this kind of case, so it's 45 to 70, that's what you're finding on the internet or wherever, right? So just broken in that category. Well, a couple things, is, if you had the data skills and it was this national estimate, you just go into the data set like NHANES and just change the age group, right? But lacking those skills, I don't know, I would contact the agency that put it out. And, you'd be surprised because sometimes, they have certain guidelines where like, all right, we can only sell this, data set, whatever. But sometimes, they're sitting there and their job is data analysis. And so if you get, a hold of people in their department that does that, right? Oftentimes epidemiology, they may be able to do that for you and want to do that. I haven't tried that theory, but it just kind of makes sense to me, when I've dealt with, people, in the state and stuff like that. So if they have the time, which, during COVID pandemic, they probably didn't, but now that they have more time, you might be able to get it. You might be able.
All boils down to relationships sometimes, as someone comments here. They're on a first name basis with the key analysts for data that they need annually. So that's a really good suggestion.
Yeah, that's the thing, right? Especially if you're doing this a lot, like, there are people behind, those websites and those data sets.
I really, really want to implore everyone to complete our survey. You'll find the link in the chat. Please grab it. Please complete it for us. It really helps us out in our evaluation of our learning series and how we can make it better and more user-friendly. And we really, really appreciate your feedback and any suggestions you have to offer. One final comment from the chat. I'm really excited to circulate these resources among my networks. Thank you, Dr. Baltras, and to those of you who coordinated this talk. Many thank yous. So we really appreciate you all joining us today. Thank you so much again, Dr. Baltras, for the wonderful information and resources you shared today, and we hope you all have a fabulous afternoon.